It's December 1st, 2022. So I'm going through this medical thing. This is the color of the mask for whoever they're involved with at this portion of North Shore. It's different than the other office and a different anatomy that I went for some diagnostic testing, trying to figure out what exactly is wrong. Um, So this particular one goes by three letters just to remain respectful of GYN. Um, I did not go back to the NYU representative. I this time went to Northwell because NYU made it so incredibly difficult. They put up roadblocks. So I'm not engaging and crazy. Um, so I went back to Northwell, even though they've hurt me before. Um, and this is what their system looks like. They mention it's a division of North Shore University Hospital. Then it says division of Glen Cove Hospital. I grew up in the Glen. Not Glen Cove, but I grew up in the Glen. The Glen Way. Then it's Division of Long Island Jewish Medical Center. And then it says Division of Lenox Hill Hospital. And then it says an affiliate of Northwell Health. Well, let me tell you something. Going into this doctor's office, the doctors themselves are fabulous. The staff that they staff the office with makes me uncomfortable. I'm sitting on a table without getting graphic of what a GYN is, completely exposed from the waist down because I'm having an issue and I can't figure out where it's coming from. If there's an internal bleed, if there's why did I need a sudden blood transfusion out of nowhere? Where did my blood go in anemia that has not been addressed or even factored in, or like me even being given a course of action by the professional medical professionals that are practicing medicine on this island. So I go to this doctor's office, and while I really appreciate the two doctors that I saw in this practice, building is fine. I mean, like, the physical building is fine, the location is fine, like all the stuff that like real estate developer cares about and like investment portfolios, whatever. The staffing is the problem. I do not want to be touched or seen. I don't want someone standing with a light like I'm in an adult pornography like film with strangers. Doctors, whatever, I'm getting over my whatever. But the supporting staff, I'm not comfortable. I'm not. I don't know where they come from. I don't know why every doctor's office I go into, they're staffed with this hodgepodge. It's my personal health. I'm not talking Starbucks. I'm not talking McDonald's. I'm not talking like the library. I'm talking about an intimate health issue and health crisis for which I don't want mixed blood problems entering the facility. I don't want to give my private information away, but yet the staff has access on their computers to all my very intimate, private information. I'm not all right with the way that they built this health system. Really, I'm not. I wasn't, if you ask me as a kid, and I'm certainly not now. And then they just hide and get in through all sorts of vents of like, it's an employment contract, it's civil rights, it's this, it's that. Where are my human rights? I'm in a health crisis. There's definite postage problems. What, I mean, like, at the most basic of my personal freedoms, my personal rights, and my human rights are being violated constantly while I'm trying to fix my health paradigm shift with other things going on this island. And it's like I'm being disrespected at every office I go to. And these are the offices that my health insurance puts into my algorithm. So I have no way of avoiding this. I can't just walk in and say, you know what? I'm going to go see a different doctor. There aren't that many doctors. And across Long Island, I'm having this mixed staffing issue. So, I mean, like, I don't understand if I want and need a specific nation and tribal safety net to touch my private health while it's in crisis. How and why am I unable to get to a segregated office to handle my very private woman issue? It's like forcing me in bed with people I don't want to be in bed with. I mean, that's where the crossover is at Paradox and real serious issues that are going on in my life frame. That, I mean, my mom would never have wanted to be touched by the staff. I know she didn't agree to this. She wouldn't have wanted, my grandmother, forget about it. She definitely wouldn't have allowed this. My mother wouldn't have allowed this if somebody had asked her and actually was going to make sure the building of the structure of Long Island was integritous for my becoming a woman in this life frame on this island and inheriting the bounty for which my parents were part of the building of, since they seem to be in a party that has political prowess and family representation. So why am I now of age and in like what I've inherited is nothing but problems, and nothing my parents would have built, by the way, at all. So now this becomes a problem. I mean, in a place where they pride themselves on personal freedoms, personal hygiene, and being like the land of the free and the brave enough to speak up. Well, I don't want retaliation either. But here we are, at now my personal freedoms are being taken away, and I'm being forced to have this mixed room situation as I'm in a health crisis, and there is no walking away or stepping away and saying, no, I'll go seek treatment elsewhere. I don't even have that option because that's been taken away. That freedom of choice has been taken away. This is the problem within New York State. This is like a small tip of an iceberg that is such a larger issue. This many whatevers forward. I don't want to be touched by non-national members or non-familial members or members from outside of my family tree. I don't. And I don't want representatives from somebody else's family tree in the room staring at me while I'm exposed. But here we are. I can't even get that simple personal freedom in New York in the year 2022. That's a problem. It's star 1978, star 8378, Nicole Cattaruzza. From a patient perspective, and now having to seek out care and even discern. So, on another note, had the sonohistogram completed as per the North Shore emergency doctor. I found one of their OBGYNs. I went to go see the GYN. He sent me in office, so it was in one building. It was really convenient, so thank you for that. In technology upgrades and advancements that I do have access to for diagnostics. They didn't see anything. They didn't see anything abnormal. They didn't see there's no polyps in that anatomy. There's no weird shifting of lining or anything. The doctor himself, though, I went back to see after Fugner. I went to Hawk, and I sat with him, and he went through his AMA stock answers of, I'm 44, 51 is menopause, it must be hormonal. And I'm like, right, but there's something that might be throwing my endocrine off, which it might be a bacterial. I mean, that's what I'm really trying to figure out, because it seems to be a systematic issue. I mean, again, this disappearance of blood, like it's a larger picture window than just the one anatomy that you specialize in, and I'm trying to really gain. So he gave me his analysis based on the anatomy that he specializes in, which I hear him. I get they just shuck it off to it's hormonal. No, it's more than that. It's something is offsetting, whether it's a bacteria causing abnormal ammonia issues. Again, not sure if it has to do with outside environment that I have no control over, but somebody's in charge of the chemical distribution and the alcohol, the amount of burning alcohol vehicles and fueling stations on this island. Somebody is responsible for that. I just don't know who. But that is taking a toll on my personal health that is outside of my control and I have no escape from. So that's another dimension into how many dimensions do I need to make this case really crystal clear in my efforts to see what is available to me and where am I seeing problems for my own personal um, issue that I'm trying to get through. So anyhow, so I mentioned to him with the fact that it could be bacteria throwing like the acid, like again, it's so intricate, and I'm lacking the access to the doctors at like an infectious disease, or like I saw that show yesterday. I never actually saw an episode, but yesterday I saw an episode of House. I've heard the TV producers put on this House doctor. There's nothing like that in any hospital I've ever been in. They've never sent in a doctor that actually cared and tried to deduct out with reason what the health problem is. I don't know what private practice calls those types of doctors. I have no idea. Again, yesterday I went in, they asked me to look over the paperwork and it said HMO on it. I'm like, what is an HMO? I was like, what's the difference between an HMO and a PPO? Like, there's nobody here in the field to describe and explain these things to my age person. I mean, I've been to schools, I've been to universities, and they structure these things together, but they don't teach the children. I don't think so far, my 10-year-old, where I'm like actively involved and I'm not going to work daily, he is my work, him and my health. I'm not, like, there's no instruction. I mean, like, they're not even, it's a really piss poor system on how are they educating the public at this point. I mean, is that because they're not it's not working? I mean, that's even more frightening of a question. It's star 1978, star 8378, Nicole Cattaruzza. So it's not a polyp, so that's good. Still have to go for a colonoscopy. But I have to get over this thing that I'm going through with these weird fevers that come on and off in I don't know what kind of infection I'm trying to get over with natural immunity only. I mean, because the doctors aren't finding whatever. I had special blood tests run yesterday, so it takes 5 days to get those results back in. I have no idea. It's star 1978, star 8378, Nicole Cattaruzza. It's Earth, solar system, Milky Way, universe, galaxies broken. And I'm in, this is Manhasset, New York, which is 11050.